Coming up next, you'll have an opportunity to find out more about one of the complications that happens in hospitals that can cause devastating injuries to patients, and that is hospital-acquired infections. Gwen Rogers is my guest, a legal nurse consultant, highly prepared and well-credentialed in the field of infection prevention. As a nurse, Gwen, we just finished your podcast. What were some of the topics that we covered?
We talked about healthcare-acquired infection, the liability around healthcare-acquired infection, the significant impact that a healthcare-acquired infection can have on people's lives. We talked about what to look for in a medical record that would help pick out the things that people should look for, such as central lines, peripheral IVs, urinary catheters, checklists. We talked about CMS and who reports and what do they report to CMS. We talked about what is a SIR and how you can tell what a facility rate or SIR is, whether you can tell if a facility has a high SIR or a low SIR, if that tells you anything about their infections at that facility.
There were a lot of details that we covered. You'll get a sense of how the LNC can be involved with attorneys on hospital-acquired infection cases, specifically the kinds of things that go into establishing liability, which is a huge issue for these types of cases because often the damages are significant. Loss of life, loss of limbs, weeks and months of extra treatment that would have been unnecessary. So be sure to catch Gwen Rogers' podcast on this topic coming up next on Legal Nurse Podcast. See you then.